Listen to your doctor.
Ask your doctor about adding Seroquel XR today.
Ask your doctor about Plavix today.
Ask your doctor about Nasonex.
Ask your doctor about Yasmin.
Talk to your doctor about Zoloft.
Just talk to your doctor.
Talk to your doctor about your risk.
Ask your doctor.
Ask your doctor.
Talk to your doctor.
Talk to your doctor.
Talk to your doctor. Ask your doctor.
Most Americans are not really aware of the implications of some of the things that are going on in medical research right now. There's an example of a drug called colchicine, a medical treatment for gout for over 1,000 years. The FDA said that if any organization wanted to, they could do their own clinical trials on colchicine. An organization did a clinical trial on colchicine, said it's effective for gout, something we already knew. It now has the patent on it. So a drug which initially would have cost you $5 will now cost you $400.
Without a doubt, our medical system is in trouble in general, just without the billions and billions of dollars that we spend. And I think the problem we have is where the cost of medications is becoming insurmountable. I mean, the strain on healthcare is huge. You know, these medications are extremely expensive. You know, the pharmaceutical companies definitely charge a lot of money for it.
The top line of $630 billion is not the full story. Drug companies actually have very high margins on products they make. In many cases, what a drug company is doing is buying a smaller firm that actually did that work. And once that drug has been approved and certified by the FDA, it may only cost them 50 cents for something they're selling for anywhere from $10 to $100. They end up having 14, 15 years of a patent. So the profit margins for drug companies are often in the neighborhood of about 80 or 90%. The stream of income from every one of those prescriptions can go into the thousands, in some cases with cancer drugs into the hundreds of thousands per patient. So the upfront cost of development is more than offset by the back-end income from patients, given the low price of the production of those pills and the high income that they bring in from patients who are sick who need that treatment.
The difficulty here is that, remember that the federal government is sponsoring the purchases of these things. Insurance companies, are, which are paid for by our employers, are sponsoring those things, or we ourselves are paying for this kind of insurance. So there's all of these hidden costs that go along with brand name pharmaceuticals.
For example, when I was on the Adderall, they prescribed me at first the extended release because pharmaceutical company still has the patent for that. The psychiatrist doesn't want to give you the instant release version, which is generic, because the generic equivalent doesn't make them any money.
As long as the medication works well, and you shouldn't need the more fancy, the more expensive one. The cheaper one works.
It's the same active ingredients, it's the same exact percentages of chemicals. So health companies in some ways do have an incentive to keep healthcare expensive, because that means that their salaries can be higher, that means their marketing budgets are higher, etc., because it's a percentage, not a set amount.
So when a patient comes in, the doctor tells them, we need to give you a treatment, we're going to give you Vioxx. Well, how did you get from, we need to give you a treatment, to Vioxx? On the one hand, the doctor has been sort of wined and dined getting them to switch to the latest blockbuster drugs.
A number of different pharmaceutical companies have sales reps that come into the doctor's office promoting their drug to the physicians and also to the physician assistants. And they give you pamphlets, obviously emphasizing all the pros to their medications. Sometimes they'll also offer to take physicians out for dinners or lunches or things like that. Financially driven things for the physicians, trying to show that their drug is better than the competitors.
Doctors are often taken out to, conferences where the drug companies will put them up at hotels and pay their travel and do all that stuff to encourage them to pick up the latest blockbuster drug. And we've all been to the doctor's office where you get free samples, because of course those drug reps are in there giving them free samples. It's another form of marketing to encourage the doctors to give it to you, and then for you to come back saying, hey, that stuff worked well, please give it to me again. On the other side, building brand recognition will help you. The doctor says, well, there's Vioxx and there's something else. You might say, well, I've heard of this one, so let's go that way.
Direct-to-consumer advertising in the pharmaceutical industry is really a strategy by which medical ethics or medical imperatives are actually removed. So now in direct-to-consumer advertising, a corporation will sell a drug directly to a consumer that might not know anything about the drug.
So the vertical integration allows them to capture more value in the value chain from start to finish. And it gives them a stranglehold to whatever the medication is. But in that whole process are a number of problems.
Pharmaceuticals are very dangerous. I was prescribed Vioxx. It showed promise. It was really good. A few years later, I found out that Vioxx was actually pulled from the market because it was giving people heart attacks.
So much money and so much effort was put into the advertising, the branding, and the building of that brand that they suppressed information. You know, there were a large number of fatalities that came from taking it. It was eventually pulled off the market, and Merck was ultimately sued for that.
Disease mongering is an interesting term. Traditionally, a doctor comes in, evaluates your symptoms, gives those symptoms a name, and then fights them. And of course, historically, we do have a kind of disease monger make some kind of snake oil product and says, oh, this is gonna cure all your ills. You know, slowly but surely, we have eliminated those things. But in contemporary pharmaceuticals, we actually have this issue coming up again, especially I think with pain medications and with psychoactive drugs, so like antidepressants, things like that. And what's happening is that everything is now a disease.
I know a lot of the time people will call and say, do you have this drug? And I know there's just been a commercial for it because it's out there and it is being pushed by the companies.
We do see that in patients. They definitely will see, you know, a medication all over the television or, you know, in an ad. They do tend to come up with a disease process that sometimes correlates to a medication.
Things that before existed, like my favorite is seasonal affective disorder, which is basically when it gets cold and dark in the winter, you get depressed. But now we've pathologized it. So if you get sad, you are now prescribed drugs to fix the problem. So what's happening now is that pharmaceutical companies are encouraging us to pathologize everything, to make everything into a sickness. When you make everything into a sickness, you can medicate everything. So what maybe 30 years ago would have been absolutely absurd to medicate, and in fact the FDA might have pounced on it and said, no, you can't do that, that's crazy, that's disease mongering. Well, now it's allowed, because now it's called seasonal affective disorder, or now it's called ADHD.
The words, you know, Adderall, or, you know, Vicodin, which everyone seems to know of here, aren't really known in England. And I came to America and I realized all these kids had their Adderall. I thought that, you know, a lot of them have an advantage over you. So I guess I tried to make a level playing field, thinking, you know, the person that's taking, you know, Adderall to stay up and, you know, to work hard, I need that, you know, to compete with kids and the other students. I need to have that same thing. And then I went to go see a psychiatrist, and it started off on a very small dose of just one drug, and it just kind of built up, and like before I knew it, I was on 7 different medications.
I've been prescribed
A variety of different medications.
Vicodin for pain,
Adderall for ADHD,
Xanax
and Valium,
Klonopin,
Ambien for sleep, and Trazodone for sleep as well.
And this is incredibly problematic because what that's encouraging is for us to have people on drugs all the time, and then counteracting one drug with another drug with another drug. Go to college students, you have 70-80% of college students on drugs of some kind.
So ironically, some of the problems you have with your anxiety are caused from the Adderall. So because of a prescription that you're taking, you're having to take another pill to and actually be able to, you know, sleep at night.
When you have a system like that, it can cause incredible problems because everyone thinks they're sick all the time, and they don't think that, well, maybe the reason I'm sick is because I'm on so many drugs.
With doctors prescribing medication like that, a lot of the times they do it and they don't really look out for the best interest of their patient.
The thing I was most upset about is that I wasn't properly informed. I was diagnosed with depression, and I was prescribed a drug called Seroquel. I was prescribed it at a small dose, and then my dose was increased and increased. And I realized that, you know, I began to think it was turning me into a bit of a zombie, and I wanted to get off it.
There'll be some patients that come in and they're getting meds that are for psychiatric treatment, and the doctor will just keep adding things on, and each time I see them, they don't seem to be getting better. They just seem to be more confused or less coherent. And I think to myself, well, when I first met them, they were kind of peppy and excitable, and now each time that I see them, they just seem to be more run down and zombie-like, and I sometimes don't think that that's actually, their life isn't any better for taking the meds.
And I just stopped taking the medication one day, and 2 days later I was going through like terrible withdrawals, like having cold sweats, and it took me the better part of 6 months to slowly taper off that medication. I was never informed that by taking this medication you are going to be dependent on it. You know, I felt like an addict to it. Like I would go to a friend's house and realize, oh, I can't spend the night because I haven't taken my medication. So you become a bit of a slave to not only the medication, but, you know, the pharmaceutical company, the psychiatrist himself.
People wouldn't think that, you know, it's bad to take these drugs, but in reality it's just like taking a lot of the street drugs, just in controlled amounts. From the Klonopin and the painkillers, that's something that, you know, is a very slippery slope, and I was taking them every day as prescribed, and then I started taking more and more because the effect would wear off and I would build a tolerance to it. And I was actually addicted to both benzodiazepine as well as Oxycontin. And, you know, at first when I was taking them, I didn't really realize what the side effects would be or how it would affect my life in the long term. I just took them because I needed to for pain or anxiety, because I did have, you know, symptoms that I would need to take those drugs in order to help relieve that, you know. But, you know, after a while I needed to have the Oxycontin or the Vicodin or the Xanax in order to feel normal, or, you know, and it became an addiction. And it ruined my life because I couldn't acquire the right amount because I kept on taking it so excessively. I'd have to buy them from the streets, and it became a vicious cycle, and it really did destroy my life.
I think there are a lot of things that we can do to address the issues with pharmaceutical drugs. I think that completely banning to consumer advertising would be really good, and completely banning the concept of marketing a drug directly to consumers. That would be really important. I think that limiting the amount of money that pharmaceutical companies can spend on wooing doctors, for instance, you know, that pharmaceutical reps go and can treat doctors to these lavish conferences, you know, where you might go and speak, or you might just go and sit in a room for an hour, and then you get to spend a week in Hawaii. Those kinds of things can be limited, I think, really easily. Limiting the amount of money they can spend on lobbyists.
Tort reform on how the drug companies are dealt with regard to lawsuits against them for ineffective drugs, or drugs which are dangerous, or vaccines which prove to be dangerous as well.
Or limiting the kind of revolving door in Washington, which is, you know, you start an industry, you go into Washington, you leave Washington to become a lobbyist, then you might go back into industry, and you might go back into Washington.
More often than not, a lot of these decisions are bad decisions being made on behalf of the drug companies against the American public, and ultimately with the support or tremendous pressure of other lobbyists. So there's a lot of things, but, you know, when this stuff gets to court, you have to trust that the judge sitting behind the bench who's making a decision on this is educated enough to understand the implications of what he's doing. Because we've seen a couple of cases where courts will make a decision not really understanding the technology, only to find out later that the decision was radically inappropriate. And in the medical supplies industry, what that does is it slows down the process of development. And in the end, it endangers the public.
Definitely do hold some resentment towards the pharmaceutical companies and the drug industries that dispense these drugs, but at the same time, I'm not going to blame them for what happened to me. You know, I did what I did to myself, you know, regardless of the pharmaceutical companies. You know, it's not them who shoved the drugs in my mouth. It's not them, you know, it's not the pharmaceutical company's fault that I took those drugs, you know what I mean? But the most important thing is that I bounced back from it, and now I'm living a good, clean and sober life. I'm coming up on 6 months clean and sober, and it's really changed my life for the better, and it's taught me a lot of things, and I believe that past experiences really shape who you are as a person. And, you know, that experience, even though it was dark and gloomy part of my life, it really shaped who I am as an individual today. And, you know, I wouldn't take it back for anything, because I feel like I've grown and matured from the experiences that I've had in my life tremendously.